Thank you for joining us here today at the San Diego Central Library. Joining me is the Attorney General of the great state of California, Rob Bonta, the Chairwoman of the County Board of Supervisors, Nora Vargas, the U.S. Attorney for the Southern District of California, Tara McGrath, and the CEO of Sharp Healthcare, Chris Howard. Those are the folks that we'll have speak. Don't worry, not everyone is speaking, but everyone is available to answer questions that you may have. We have a number of leaders here today from the federal, state, and local governments, as well as local healthcare and homeless services providers and other local institutions. We all came together this morning to engage in a candid and comprehensive discussion of something that is devastating families and communities up and down the coast of California. It is a profoundly challenging problem that is exacerbating our state's homelessness crisis. It is the growing distribution and abuse of fentanyl. The statistics are sobering, and the human toll is immeasurable. Last year, in the city of San Diego alone, 624 people died from an accidental overdose. In 66% of those cases, illicit fentanyl was involved. That's 410 people who lost their life. For comparison, just 5 years ago, 45 people died due to fentanyl overdose. So that's an 800% increase. Let's wait for just a moment for the helicopter. Last year, 181 people experiencing homelessness died due to a fentanyl overdose, making it the #1 cause of death for this population. And during the past 5 years, the fentanyl death rate among people experiencing homelessness has increased nearly 6,000%. That's why, in November of 2022, I signed an executive order directing greater law enforcement and legislative action to address the illicit fentanyl crisis. In the time since that executive order was issued, the San Diego Police Department has increased arrest of fentanyl dealers by 63% in the city of San Diego. I want to thank Chief David Nislight and the entire San Diego Police Department for making this issue a priority and for bringing these merchants of death to justice. Under this executive order, we are also prioritizing several initiatives that are funded by proceeds from a legal settlement with opioid manufacturers. That has included 66 new shelter beds with drug treatment services done in partnership with the County of San Diego, laser detection devices for the police department to use to test for fentanyl in the field, and a jail diversion program to get low-level users into treatment. Our efforts, however, have not stopped just at our city boundaries. I've also partnered with state legislators, like San Diego's own Assemblymember Brian Mainshine, to introduce legislation to enhance penalties for dealers when their actions result in someone's death. Unfortunately, neither bill that we've sponsored this year was successful, but I'm committed to continuing to seek state legislation to address this crisis in 2024. The fact remains that the rise of illicit fentanyl presents a grave threat to our communities and to our society. In all levels of government, as represented by the individuals standing behind me this morning, we are committed to working together to stem this tide. We cannot afford to be passive observers in the face of this crisis, and so today we shared strategies, lessons learned, and potential solutions going forward. I myself have walked away impressed with the level of expertise that we have here locally and the dedication each of these stakeholders expressed to address this particular problem. This is a problem that demands a unified response from all segments of our society, from government to healthcare, law enforcement to our broader San Diego community. And today, we stand here united to stop the misery of fentanyl and what it is causing here in San Diego and across California. We must work together and support one another, and we must be resolute in our efforts to curb the rise of illicit fentanyl, and most importantly, to save lives. To talk more about the actions that he is taking, it is my honor to introduce the Attorney General for the state of California, my friend Rob Bonta. Attorney General?
Thank you, Mayor. Thank you, Mayor, and Rob Bonta, Attorney General. Just want to first say, just really grateful for the roundtable I just had the chance to participate in, and what I saw on full display here in San Diego is what I often see, but was very impressive today to see it firsthand and to see the details and the concrete work. I saw leaders from multiple parts of government, federal, state, local, teaming up, coming together, using Well, recognizing first that we are in a full-on state of emergency, full state of crisis when it comes to the fentanyl epidemic, and that they are rising to the challenge, meeting the moment, teaming up and finding pathways forward to save lives, understanding all too well the personal tragedy involved for the people of San Diego, lives lost, children's lives cut short, futures dimmed and darkened, and they're working together. And they're working from a public health angle, a law enforcement angle, and I believe it's a model for what other counties can do and what other states can do, because this is not just a California problem, San Diego problem, it's a American problem. And so in moments like this, when we are challenged and have difficulty, we come together. And I saw that today. And I was pleased and proud to see the passion, the potency, the talent, the power of that partnership in the room. And so I'm excited for what not just San Diego will continue to do for its people and its communities to address the fentanyl crisis, but what others can learn from their example. So grateful for that conversation, and we're going to continue to do our part at the California Department of Justice. We believe that we need to be coming at this from all possible angles to address our fentanyl crisis, and that's why I created our own fentanyl task force a couple years ago. I made a specific request to the governor to fund and get stood up in our office our fentanyl task force team that is now working throughout the state in San Diego and Dublin and Sacramento and other locations. We've been operating, and since April of last year, we've seized over 10 million pills, nearly 1,000 pounds of fentanyl powder, and that work is ongoing. We will continue to do that work. We've used our sophisticated investigative and surveillance techniques to be involved in major takedowns of those who are moving fentanyl throughout our state. We were part of a arrest and investigation, a tragic case where a fentanyl dealer provided fentanyl to a 15-year-old in the Roseville area, and she died, and her parents are now living without her. A homicide charge was brought and a homicide conviction was secured. And so in that specific case, under those facts, justice was served, and we hope that there's a measure of relief for the family knowing that justice was served. We've also been involved in holding accountable our opioid companies throughout the country who have fueled the opioid crisis and who need to be held accountable for it, and we have been. We've taken $36 billion plus in settlements, bringing $2 billion of resources to the state of California for abatement, for mitigation, for prevention, education, to continue to provide harm reduction from fentanyl in our communities. And so that will continue. We're proud to support a legislative package that embodied that all hands on deck, all approaches. And we got 5 bills passed and signed this year that provided treatment and harm reduction, enhanced sentences, and other approaches to address fentanyl. So from litigation to legislation to enforcement to public health approaches, we will continue and education, we will continue to use all tools that we have to continue to address this crisis. But I will say, while I wish we didn't have to come together in this room, and there's nothing happy about the reason that we come together, I was inspired by the work, by the commitment, by not just the record of success already and the ongoing work, but what the future holds for San Diego's ongoing commitment. We're proud to be a part of it. We're proud to team up. And in that spirit of working together, collaborating, partnering, we're proud to join the fentanyl abatement and suppression team that is operating here in San Diego, helping address the major challenge that we have in this state and in this country of fentanyl coming across the southern border of California. And so we're putting our resources in, our talent and our team to join with the already incredible leaders on the team, from the U.S. Attorney's Office to Homeland Security to Border Protection, DEA, and many others working together. And it's that spirit of coming together in moments of crisis like this that I think will get us to where we need to go. It will not happen overnight, but it will happen when we work together. and stay committed. So proud to be here and proud of the wonderful leaders that I have the honor of standing up here with. Thank you.
Introduce our county chair, Nora Vargas.
Thank you. Thank you, Mayor. Thank you, Attorney General, for being here today. Nora Vargas, Chair of the San Diego County Board of Supervisors. And it's truly a wonderful opportunity to be here with all of my colleagues. And it has been stated here before, I think today really marks another space where all of us as San Diegans come together to take on what someone called today, address one of the major issues that is impacting our communities and was defined as a national security issue. And to think about what illicit fentanyl has done to our communities is we think about the numbers and the increasing numbers and how it's impacting our communities. This is about real human beings. It's about our family members, our sobrinos, our children, somebody's brother, sister, and the impact that it has on our families and the victims. And so it's important today to hear firsthand from law enforcement, from our justice advocates, and to hear firsthand some of the interventions that are taking place and how each one of them are working to try to do their piece to deter what is happening. But what I want to make sure I emphasize is that the County of San Diego and many of my colleagues were here today from the County of San Diego to emphasize that we are here and we are committed more than ever to making sure that we do everything in our power to make sure that we do everything we can to deter this in our communities. As a county, we've stepped up to make sure that we're fighting the illicit usage of fentanyl in our communities. We've declared it a public health care crisis. What that means is that we are doing everything so that it's all hands on deck. We are talking about healthcare integration, harm reduction and prevention, social services support. We're talking about education in our schools. We're talking about making sure that the resources are in their communities. We're providing life-saving Narcan and cracking down on those that provide the substances. I have to say that today it provided us an opportunity to have a discussion, all of us together, to talk about what the different interventions are, but really think outside the box. And how do we bring all of these experts, federal, state, and local agencies, to really think about what the next steps are. We came up with some really good opportunities, but it's only the beginning of the work that we'll continue to do, because I think what we have demonstrated as San Diegans before is that we can tackle anything together. And so I'm excited about the partnerships that we have, and one of those two partners is the District Attorney Summer Stephan, who has done an exceptional job in being a partner in the County of San Diego. So, Summer?
Today was a truly incredible collaborative meeting, and I want to thank Mayor Gloria, and I also want to thank our Attorney General Bonta, our Chairwoman, Supervisor Vargas, for coming together and bringing all of the essential partners to the table. Everybody from the U.S. Attorney, the District Attorney, local and state and federal law enforcement, along with providers, with innovators, with hospitals, and with the people that are doing the hard work of treating those who have substance abuse and are struggling with addiction. This today was a life-saving mission, because this is a critical epidemic in our nation. Never before has our nation faced over 100,000 people dying of overdoses 2 years in a row, in 2021 and 2022. And the majority of those deaths coming from fentanyl. And this is why we wanted to focus and address the issue of fentanyl today. In San Diego, we have not been spared that death toll. And we went from just 2019, just a couple of years ago, 152 overdoses from fentanyl to 814. That's more than 5 times the rate that that is translating into the loss of life in 2021 and again in 2022. And in 2021, what I think impacts everybody here is that we lost 12 kids in San Diego, with the youngest being a 13-year-old. Everybody who was working hard, responding to these overdoses, did double time to make sure that we save a life-saving mission of trying to get to that dealer so that the next child doesn't get killed, thinking that they're getting some kind of Adderall, some kind of anxiety pill that turns out to be fentanyl and kills them. But today's meeting was about synergizing all our forces. And we were able to show that San Diego, while being at the front line of fentanyl entering to our nation, we are at the front line of having real solutions that tackle this problem, to the point that we are considered the gold standard on how you address this crisis. But as we presented, we need more resources on the prosecution end, on the law enforcement end. We need more and better laws. We thank Mayor Gloria and Assemblymember Mainshine for fighting the fight, but we still don't have the tools and the laws that help us tackle this problem. The laws that would allow us to take a drug dealer that took a life or ended somebody in a wheelchair, like a young man that I talked to, and they get the exact same punishment as if they just shared some drugs with a friend. That makes no sense and has to change. We talked about the expansion of treatment, but we also talked about the innovations at the county that are happening that deal with a ability to track data from EMS, from hospitals, from law enforcement, in order to concentrate our efforts and be able to save lives. This is an amazing innovation by the county. And we talked about the education, including with the National Guard, that is bringing very effective education to our schools and curriculum. So today had some concrete action points, and we look forward to together saving a life in San Diego and across the nation. Oh, I would like to call up Tara McGrath. She is the U.S. Attorney, just confirmed, and an amazing partner. Already had several meetings that included us, that help us to move this fight forward.
Thank you, Summer. Good afternoon. Thank you. My name is Tara McGrath, and almost 2 weeks ago, I had the honor of being sworn in as the United States Attorney for the Southern District of California. This is my first opportunity to address you in that capacity, and it underscores the importance of this issue that this is my first opportunity, and I don't stand here alone as the federal representative, but also present at the meeting were representatives from the Drug Enforcement Administration, from Homeland Security Investigations, from Customs and Border Protection, and I represent all of those agencies, including FBI and the Marshals Service, Secret Service, because we are partners in serving our community, and the local and state representatives here to address this issue. And so I'll give a couple of remarks about what I want to tell you today on fentanyl, is that it is the priority issue for the United States Attorney's Office because it's a public safety issue. And this epidemic does not cause lives to be lost. Lives are taken. Taken by cartels that are indifferent to their deadly effects, taken by drug trafficking organizations that are happy to exploit the poor and weak to bring drugs into this country, and taken by drug dealers on our streets willing to push a drug they know can and will kill their customers just to make a few bucks. In San Diego, we are an epicenter of this crisis, as fentanyl is being trafficked across our border. It's being distributed around the nation, and half of all fentanyl seized in this entire country comes through our district's ports of entry. That means that in San Diego, we not only bear the tremendous weight of this epidemic on our soil, but we have the opportunity as leaders and partners to thwart the forces that cause those tragic deaths. There are extraordinary measures being taken at the United States Attorney's Office to attack this problem. And again, we're doing that with our federal and local partners. We are indicting suppliers of chemicals used to make fentanyl. We're indicting the cartel leaders that create fentanyl. We're indicting the drug trafficking organizations that smuggle fentanyl into the United States, the distribution networks that spread the poison throughout our country, and the local dealers that are willing to spread that same poison in our community. We are putting these offenders in prison for very long sentences. In the past 24 months, 23 defendants have been sentenced for their role in distributing a fatal dose of fentanyl, resulting in a victim's death. We partner with the District Attorney's Office and the DEA's overdose response team in order to secure justice for the victims' families, and we have sought and received strong sentences up to 25 years for those who are distributing fentanyl resulting in a death. We are partners in the Fentanyl Abatement and Suppression Team, known as FAST, that was formed 1 year ago and is already serving as a model throughout our country. During its inaugural year, FAST led or supported more than 70 law enforcement operations, resulting in the arrest of 53 prolific fentanyl smugglers, distributors, and dealers in San Diego County. Our collaboration with the partners behind us is a critical force multiplier in the fight against fentanyl. We believe that prevention and outreach is equally as important as law enforcement, and we have launched significant outreach efforts to educate our kids, including more than 50 presentations in the past year to parents, church groups, community groups, schools, and we do that in collaboration with our community outreach office and our partners. And we also, I want to emphasize, launched a partnership with SDSU and their basketball team. And by doing that, we had access to a different community, and we did so to emphasize the essential component that Narcan plays in our fight against this epidemic. We've had more than 1 million impressions from our partnership with SDSU's basketball team. We are collaborating and working together with public safety, health, and outreach partners gathered here, and I'm proud to represent the United States as your United States Attorney, newly confirmed. Thank you.
Well done.
Tara, we're glad you're here. Our last prepared speaker is the CEO of Sharp Healthcare, Chris Howard. Chris?
Thank you, Mr. Mayor, and I am Chris Howard, President and CEO of Sharp Healthcare. Sharp Healthcare is the largest provider of healthcare services across the San Diego County region, but today I speak for the many healthcare providers in our community that are faced with the same challenges that Sharp Healthcare is faced with. At Sharp Healthcare's 4 acute care emergency departments, we have seen a 90% increase in fentanyl-related exposures over the last 2 years. Over the same period of time, we've seen a 30% increase in inpatient care related to the same cause. This is not related to any one group, contrary to public opinion. We have patients from across all different backgrounds that have tested positive for fentanyl and required treatment. It truly is an epidemic across our entire community. I want to thank Mayor Gloria for your leadership in bringing together this cross-section of organizations to address this crisis, because it is going to take a combined joint effort to solve for what lies ahead. This morning, as I mentioned, we did discuss the need for region-wide actions and investments to reduce harm from fentanyl and prevent recidivism. From a healthcare perspective, increasing the number of residential treatment beds would dramatically improve patient outcomes so that we can discharge patients to the right course of care, the right arena where they can receive the care they need and not go back to a troubled environment where they may not have the resources to fight their addiction. Also, deploying no-cost fentanyl strip programs, FTS programs, as has been utilized across the country, would be a wonderful opportunity for us to help individuals identify the presence of fentanyl in a drug and also reduce the number of people adversely exposed to the substance inadvertently. Many communities across the country have followed that path, and I'm hopeful that we can do something similar here. We look so much forward to continuing to work as a healthcare provider with all of our other partners to address this vital issue, and to work with you, Mayor Gloria, Assemblymember Mainshine, and Chair Vargas, and partner organizations to help protect more lives in the future.
Fantastic. Chris, thank you very much. Just to wrap up, and then reminder, everyone here is able to answer a question for you. We got our sheriff, we have our DA, our police chief, our federal law enforcement, public health folks from the county. Really, anyone you got a question for, we got probably the answer up here. But I want to conclude by expressing my appreciation to our Attorney General for traveling to San Diego today. This is not his first time in San Diego. I don't think it's his first time this month. And I appreciate that level of attention and priority that he provides to the San Diego community on this, obviously on this very important issue. Today's meeting was just the latest iteration in the city's efforts in partnership with the County of San Diego to prioritize this very important issue. As I mentioned, a year into our executive order, you've seen the increase in enforcement, more convictions, greater collaboration with local, state, and federal partners, and we have more to do. I think this morning's conversation really highlighted the need for more harm reduction, more public education, more tools for prosecutors, and importantly, more support across the entire spectrum, more bodies and more cash. I heard a lot of that too, right? And I know that some of these ideas will be translated into decisive action by Assembly members like Brian Mainshine, local legislators like Councilmember Von Wilpert, and a lot of work still ahead of us. I want to conclude with just this action, though. While we look to take action on this crisis, what I know for sure is that San Diegans can take action right now. Talk to your children about fentanyl. Educate yourself. Make sure that you're the first line of defense on this particular crisis. We will do our part to try and educate the public, to provide the services and the programs out there, the beds that have been mentioned, working with our law enforcement partners to hold dealers accountable, cartels accountable. But the best line of defense are educated citizens who are willing to have those tough conversations with family members and making sure that this stuff never gets in the hands of our children. We will do our part, but my ask of San Diego is to make sure that you're doing your part. Learn about this issue, talk to your kids about it. Let's make sure that those numbers of children who are dying because of this gets to what it needs to be, which is zero. With that, I'm happy to throw it up to throw it open to questions from the press for any of the speakers who are up here or any of the other folks who are present. Hearing nothing, you probably want to do one-on-ones, just be my general mind reading. Okay, that's very good. All right, I know some of these folks have very busy schedules. They may need to take off, but feel free to grab whoever one you need. And again, thank you everyone for being here today. And again, thank you, Attorney General, for coming to San Diego. Appreciate it.